Hello from the Dukascopy TV studio in Geneva. We're talking about regulatory changes in health insurance for cross-border employees in Switzerland with Sandrine Conti from Swiss Risk and Care. Welcome to the studio.
Welcome, thanks.
So, can you give us an overview? What are the recent regulatory challenges concerning health insurance for cross-border employees living in France?
There was a regulatory change that started last year, and this change is concerned the cross-border employees who were previously, most of them were previously covered in health insurance with French contract, and it was a first Euro private contract. So what happened is that they were not in the system, whether the Swiss system or the French system. So as of now, as of June, every cross-border has to be covered firstly by a social security system, either the Swiss system or the French system. For all the cross-borders who already were covered with an insurance contract, because it was a French law insurance contract, they are considered to be under the CMU, which is the French social security. So this has been a major change, because also in terms of premiums, the premiums are not calculated the same way. So with the Swiss Lamal, you have a premium that is a fixed premium depending on your age and your sex. In the French system, your premium is a percentage of your total income. And it's 6% this year and will go to 8% and may even go higher.
So this could really include some disadvantages for employees, cross-border employees living in France but working in Switzerland, right?
Yes, so one of the disadvantages is that they may have to pay much higher premium, but the main disadvantages is that with the previous kind of contract, they had full access either to the French healthcare market or to the Swiss healthcare market. Whereas with the French system, the French CMU, it's supposed to be covered in France only. So if you're the cross-border employee, you can have access to outpatient treatment in Switzerland, or as any family traveling in Europe, in case of emergency, you have access to the Swiss treatments. But other than that, you have no access with under the French social security.
And Swiss Risk and Care has created an own product called Quanta Plus. So what is it about?
Yeah, so Swiss Risk and Care is really specialized in corporate insurance and also all services that we give to HR. So we have a healthcare care desk, we have also absence and claims care desk, and so our clients were concerned about being able to provide an access to the Swiss system to their employees, to their cross-border employees, because not all employees are French and not all employees know the French system. So what we did with our expert, we have an in-house broker, an in-house expert who knows healthcare very well, and we went and he designed a product that was able and corresponding to the needs of our clients and their employees and families.
And could you quickly outline the main advantages of the products and key features?
Okay, so the main advantage is that you have access to the Swiss market, especially in outpatient treatment. You can have the choice to be covered only for hospitalization or to outpatient, or only for outpatient or treatment, or both. So it's important because you have the choice, and it depends on the way you use healthcare. What is also very important is that this product does not only cover is not only supplemental to the French social security, it has wider covers, which means that, for example, you're a family, you're two cross-borders and you have kids, they will have access Swiss treatments, whereas normally they should not have because the kids are in France and you live in France. So it's something that is very important for cross-border employees, especially those living around the Devon area and Gex area, where there is not a lot of doctors available.
And could you quickly sum up what are the key points when deciding for an insurance contract? What should people think of?
Yeah, sure. So you first have to decide where do you want to have your treatments. Do you want your treatments in Switzerland, in France, or both? So, and then what is very important also is the level of cover that you need for the optical and the dental care. These covers are for France only, but there are very good covers in the French contracts, and also the level of tax applicable. At the moment, there is a 9% level of tax applicable in the insurance. But if you have contracts that are not considered as responsible by the French government, this will be of 11% more. So even if the premium is the same, you may have a contract where you will pay 11% more because of the taxes.
And Swiss Re & Care is an insurance broker helping all interested in finding the best insurance.
Yes, exactly. And we have been on the market and we have seen every insurer, and we have done a leverage, and that's how we decided, and we went with Quanta Plus.
Thank you very much,
Sandrine
Conti. And thanks for watching. Do make sure to keep clicking back on the Dukascopy TV website for latest updates and exclusive interviews. Have a great day and see you next time.